Hey, this video is to help you navigate if you're being injured while breastfeeding because your child is kicking you or pushing off of you, digging into you with their feet. There's a couple of potential causes for why they're doing that, and depending on the reason, there are different solutions that you can try so that your breastfeeding journey can move forward positively. You and your child can enjoy your breastfeeding journey together. So, taking a look at how did we end up in this position? Well, your baby, while they were in the womb, they were tucked up into this little tiny position. Their knees spent a lot of time curled up towards their chest. So when they first arrive, they naturally hang out in that position simply because it's comforting and because that's the shape of their body right now. Their muscles are different lengths because of that position that they stayed in for so long. So they'll naturally curl, but over time they will enjoy more and more being able to stretch out. So instead of feeling most comfortable being tucked into a little ball, have you ever noticed your kid eventually turns into a starfish and just spread out as far as they can possibly go in every direction? As that process is happening, they might be trying to figure out what to do with their legs and feet, and they may also just reach a point where they're enjoying, look what I can do. I have legs, I have strength, I have muscles, and they're just enjoying interacting with their world by kicking and pushing and digging with their feet. So taking a look at all those options, here's some things that you can do. If your baby's legs are digging into you, pushing, they're kicking you, and so you're getting injured in this area of your body, simple solution is just to hold them in such a way that their legs go past your body. So maybe you're providing more support up here while their legs kick and move and stretch out in that direction. Make sure that you are nursing in a chair or a couch or just an area where there isn't something to block them. I had this awesome chair that I loved to sit in, but when my son got to that stage where he just enjoyed kicking and pushing, there was an armrest right there, and so that was causing problems too, because even if he wasn't kicking me, he would kick the armrest and that would cause his body to straighten out, and then he would pull off the latch going this way. So make sure your baby just has lots of open space. Let their legs be free, and that might solve the problem. If your baby is still kicking and pushing, it might actually be gas related. If you realize especially that they're pushing backwards, they want to stay attached, but they're pushing away from your body. There's sort of an arching of the back that's being created. Chances are they actually have abdominal gas. And so any of the tricks that you have for soothing your baby and, maybe little bum rotations, rotating the hips, helping to wiggle those farts out. If you've got other techniques, go and use those. But in the end, just whatever you know to do to help get those tummy bubbles out, that might be all that's needed so that when you bring them back to the breast, their bottom half has calmed down. They're no longer uncomfortable, and so they're able to maintain a comfortable nursing position. So that might be the solution. One other thing to watch out for is just that if it is strength related and I just really want to kick and push, if you are side nursing, because you tend to, usually lie down with your knees slightly bent to brace yourself, the use of their strength and muscles can be really uncomfortable because now they're kicking and stomping down on your thighs and may have more surface area to really kerpow into. You can end up with bruises on the tops of your legs. If you find out that this is mostly happening while you're trying to use a side nursing position, I don't want you to lose side nursing because it's amazing. It opens up so many sleep opportunities to you, so let's preserve that. If you are in a side lying position, a couple of things you can do. Try tucking pillows or something behind your back so that you don't have to rely on your knees being bent in order to keep you stable. If you have something that you can relax backwards against instead of using your legs to keep you from rolling forward, that means you can stretch out and baby might have more open space. The other thing that you can do is that if baby's bringing their knees up and that's what's allowing them to then extend out and kick with force, what you can do is try to stretch out your legs just a little bit, enough that, here's the key thing, you're able to pull baby flat into your body. So, I'm sitting up right now, so it's harder to demonstrate this. But if baby is in line with your body because you are side nursing, so you're lying on that mattress or on that couch together, then, okay, if you can stretch out your body enough that you can grab a hold of their little tush and pull it in towards you, it's going to achieve two things. When their tush is pulled in towards you, then more of their body is flattened up against you and they're supported. They don't feel like they need to hold themselves there. It's the core of their body, so they're not rolling away from you. You might have a baby who just goes, oh, I feel fully supported and I'm in a ton of contact with mom. That's exactly what I wanted. And they relax, and so those feet stop kicking and stabbing into you. The other thing that it does is that it keeps them from being able to pull their knees up. They might still be working away with their feet, but now all they can do is bend at the knees and kind of do little flipper kicks, or they can wiggle their feet around. That's not to say that that's not uncomfortable sometimes, but so much better than a full knee bend, kerpow, that then stomps down on your legs. So pull them in close, pull their booty in close to you. It keeps them from bringing their knees up. It reduces how much force they can use to kick or stomp. And so with that in mind, you can also just work on behavior modification. So if you're trying to teach your baby, sweetheart, I don't like that, so we need to figure out something else to do, then every time they kick or dig in or do something with their feet that's painful or uncomfortable, you can do a little startle or a jump. If they realize while attached to you that the world shakes every time that they do that particular action, they can learn, oh, I shouldn't do that, I don't like that, so yeah, I'm going to stop so that that stops. You can say ow or no and use your tone of voice to indicate this is not comfortable for me. You can use your words saying, I don't like that. You need to stop kicking me. Don't let anybody talk you out of the idea of, yeah, your baby doesn't understand, so why bother? No, you're laying out language foundations now at this age so they can still start to put together. When I hear that tone of voice and when I hear that combination of sounds, it means mommy's not happy and I need to change something. I don't like that. It's okay to use your words. No, I do not like that, sweetheart. You need to stop kicking me. And they can start to piece that together. You can use timeouts so that if they're digging into you with their feet or kicking, that results in being set down for a time, a 5-minute timeout. If they realize that they lose contact with the breast every single time they do a certain motion, they can learn to stop doing that. And another thing you can do is use a physical response, because sometimes babies just don't understand, ow, no, it's too broad. What is it that I'm doing wrong? Or just what is it that mommy's not happy about? So using a physical response, a nip, and by a nip, I mean you're not pinching, you are not injuring your child. Instead, what you're doing is getting a hold of some of the skin and doing a nip. It's indicating gently but firmly, hey, bud, this is the limb that I am not happy with right now. So if you do a nip on the top of the foot or at the toe, whatever happened to be available, but just be specific, sweetheart, nip. This is the thing that I need you to stop. This foot, this is what's hurting mommy. Please stop kicking or please stop pushing into me. That physical response might be enough to clarify the message for your child so they know, that's what I need to stop doing. And so with that in mind, this is not a permanent problem. This is not something that you have to resign yourself to and just sit there trying to survive while your kid is kicking you. You do have options, and some babies get the message right away when we try these techniques. Other babies, it takes them a while to learn and to have it reinforced multiple times. No, mom doesn't like that, mom doesn't like that, mom doesn't like that. And a week or two later they stop. But keep going at it. Keep reinforcing the techniques, and the techniques I mentioned there sort of escalate from, just a physical, jump to tone of voice words to, a full-blown timeout to a physical response. With that escalation, if you're trying something that's just word-based, see if there's something else in that toolbox that might be worth trying that's a better fit for your child. In the end, you are trying to figure out what's the best fit for your family. And if you have a breastfeeding goal and kicking and pushing and digging is interfering with that goal, you're just not sure you can make it, hopefully those tools do help to overcome this particular challenge so you can reach that goal that you're hoping for together. So I do hope this video was helpful for you. All the best.